This is a 10-month-old female with fever and increased fussiness times 5 days, with the highest rectal temperature of 104.8 rectally per mom. Patient was seen in the ED 2 days ago and admitted to the hospital for 2 days. Her blood cultures have been negative times 2 days, urine cultures negative times 2 days. The UA was positive for WBCs, but normal for her age group. She was discharged yesterday with amoxicillin to treat acute otitis media and was given a dose last night. Patient now presents with a red generalized rash. No runny nose, no watery eyes, no coughing, no vomiting, no diarrhea, decreased solid PO intake. She does have wet diapers. She is breastfeeding every 3 hours. She seems to be sleeping a lot more per mom. Does not attend daycare. Patient also has a history of eczema. It gets worse with soap, better with lotion and hydrocortisone cream. Her past medical history includes eczema. She does not have any allergies. Her medications are amoxicillin, 2.7 milligrams of the 400 milligrams for 5 ml concentration, PO, BID times 10 days, and she only got 1 dose last night. Children's Motrin every 6 hours, and hydrocortisone cream for the eczema. Her immunizations are not up to date. She is due for the Hib vaccine and the pneumococcal vaccine. Her social history is non-contributory. Her family history, her mom has a history of hypertension due to kidney issues. On physical exam, this little girl is fussy, but she is consolable. Her ears have mild erythemas, and you're not able to really visualize any landmarks. There's small amount of fluid, slightly bulging, mildly tympanic membranes noted bilaterally. Her sclera is white, conjunctiva pink with no discharge. Her nose was patent, there was no discharge. Her throat, there was no injection. She did have +1 tonsils with no exudate. Her lungs were clear to auscultation. There was no respiratory distress. Her heart tones were normal. Her abdomen was soft and non-tender. There was no joint pain. Her neuro-wise, her cranial nerves 2 to 12 were completely intact. Her fontanelle, her posterior fontanelle was completely closed, and her anterior fontanelle soft and flat. The only thing that was noted was that she did have this diffuse generalized maculopapular erythemus rash that was blanching on her upper and lower extremities, and her trunk and her back. So in summary, this is a 10-month-old female with fever and increased fussiness times 5 days, admitted to the hospital for 2 days. Her blood cultures have been negative, urine cultures negative, UA was negative. She was discharged yesterday on amoxicillin to treat acute otitis media, and she presents today with a general red flat maculopapular rash after a dose of antibiotics. This patient most likely has roseola due to the negative cultures and now presenting with the viral exanthem. I doubt she has acute otitis media because of the negative history of her upper respiratory infection and no ear pulling. Her secondary diagnosis is eczema, and she's to continue her treatment. Her third diagnosis is immunization delay. We'll schedule to get her Hib and the pneumococcal after she is 24 hours afebrile. And her plan is to discontinue her antibiotics, do symptom management, and hydrate. And we are to have her follow up and return if her fever returns, if the rash gets worse and she starts seeing it peeling, vesicles on the hand, or any changes in level of consciousness. Thanks.